Hi, I'm Dr. David Sparks, and I'm here to talk to you about the treatment of snoring. Wouldn't it be great if snoring no longer existed in your life? Knowing that the majority of men and women who are 40 and over snore, what can you do about it? Well, the simplest ways to treat snoring with some amount of success are, I'm going to list a bunch for you. 1, lose weight if you're overweight. Sleep on your side, because if you sleep on your back, the throat has a tendency to collapse at its most. Raise up the head of your bed, kind of like halfway sitting up. A lot of companies say opening up nasal passages with their nasal strips works. I have to confess I'm a little bit skeptical about that. Treat chronic allergies. Correct structural problems in your nose, for example, a deviated septum. Limit or avoid alcohol before bed, and avoid taking sedatives before bed. Now, believe me, there have been all kinds of surgeries that have been tried over the years aimed at literally reducing the size or amount of the floppy tissues that are set into motion or vibration due to a constricted airway, which results in recognize that? Okay, here comes a big word. Uvulopalatompharyngoplasty, or UPPP, is a surgical procedure performed in an effort to remove tissue and or remodel tissue in the throat. Tissues which may typically be removed include the tonsils, the adenoids, the uvula, the soft palate, and the pharynx. Again, the idea is to open up the airway by reducing the volume of tissues that vibrate. This surgery isn't performed much anymore because it is complicated, doesn't always produce effective results, and is extremely painful in its aftermath. I was involved with a company that sold ear, nose, and throat doctors a radiofrequency laser probe, or needle, which was inserted into the uvula, soft palate, and the nasal turbinates. The radiofrequency basically caused molecules in these areas to rub together and thus produced heat. For example, think about rubbing your hands together, hard and fast like that. You know what's happening right now, right? They heat up when you do that. Same idea here, only using radiofrequency energy to heat up snoring tissues, kind of like microwaving them, can produce a hardening or a stiffening of the snoring tissues. Patients will say that it worked for a while, but eventually their snoring returned. Now, there are all kinds of inexpensive boil and bite devices that you can buy where you essentially drop a malleable piece of plastic into boiling water. It heats it up and makes it even more malleable. It softens the plastic, and then you take it out and then bite into it, thus formulating, I guess you would call it a customized mouthpiece that you sleep with. And the idea is that the mouthpiece is designed to pull the lower jaw forward, thus opening up the airway. Even though you hear a million ads for them, most patients I've talked with who have used them say they are not very effective. Sorry. The world of dentistry has dived into snoring treatments by fitting patients with oral appliances. These are just more sophisticated mandibular advancement devices than the boil and bites that I just described. They do work for some patients, but they can produce discomfort in the temporomandibular joint. Patients often complain about aching jaws and headaches. Okay, so that's it for treatment of snoring. Next episode, it gets worse: obstructive sleep apnea.